Introduction to Chemical Modifications in Drug Design. Welcome. Today we are diving into one of the most fascinating aspects of drug design, chemical modifications. Chemical modifications are essential for making drugs more effective, safer, and better suited to patients' needs. There are two major strategies we'll focus on. Analogues. These involve structural transformations of the parent drug. Prodrugs. These are inactive derivatives that become active only after metabolism in the body. Both approaches aim to optimize drug action, improve patient outcomes, and overcome limitations in the original compounds. Let's explore how each works with some clear examples. Analogues. Detailed explanation. Let's start with analogues. An analogue is a modified version of a parent drug. These modifications can involve changing the carbon skeleton of the molecule, adding or altering substituents to enhance the drug's functionality. The purpose? To fine-tune the drug for better performance while retaining its therapeutic properties. Examples of analogues. Here are some key examples to help us understand analogues better. Tetracycline family. Antibiotics. The tetracycline family includes oxytetracycline, dimethylcycline, and chlortetracycline. These analogues differ in their ability to treat various bacterial strains and their behavior in the body. Diethylstilbestrol, hormone analog. A synthetic analog of the natural hormone estradiol. It mimics the hormone's effects but is more stable and longer lasting, making it ideal for hormone replacement therapies. Beta-lactam antibiotics. The famous penicillin G was modified to create ampicillin and amoxicillin. These analogues are not only more resistant to stomach acid but also cover a broader spectrum of bacterial infections. Sulfonamides, antibacterial agents. The development of analogues like sulfadazine and sulfamethoxazole improved their effectiveness and reduced side effects. Importance of analogues. So, why are analogues such an important strategy in drug design? Improve activity. Example, dimethylcycline is more effective against resistant bacterial strains than tetracycline. Reduce side effects. Example, second-generation antihistamines like loratadine cause fewer sedative effects than older drugs like diphenhydramine. Enhance stability. Example, modifying penicillin to create amoxicillin allows it to survive stomach acid, making it suitable for oral use. A target specificity. Example, selective beta blockers like atenolol focus on heart receptors, minimizing effects on the lungs. Analogues truly showcase the art of precision in drug design. Prodrugs. Detailed explanation. Now let's move on to prodrugs. A prodrug is a derivative of an active drug that becomes effective only after it is metabolized in the body. This transformation can happen through enzymatic hydrolysis, where specific enzymes break down the drug. Metabolic reactions such as oxidation or hydroxylation. Why create prodrugs? To solve challenges like poor solubility or absorption, bad taste or irritation, rapid degradation in the body. Examples of prodrugs. Here are some excellent examples of how prodrugs work in real life. Testosterone propionate, hormone therapy. A prodrug of testosterone, it releases active testosterone gradually after hydrolysis, prolonging its effects. Application, treats low testosterone levels. Chloramphenicol palmitate, antibiotic, a prodrug of chloramphenicol, designed to mask its bitter taste, making it easier for children to take. Application, used for bacterial infections. Phenylbutazone and oxyphenbutazone, anti-inflammatory drugs. Phenylbutazone is converted into the active metabolite oxyphenbutazone, which reduces inflammation and pain. Codeine, pain management. A prodrug of morphine, codeine is activated by liver enzymes and provides effective pain relief with less addiction risk. L-DOPA, Parkinson's disease. A prodrug of dopamine, it crosses the blood-brain barrier and is converted into dopamine to help Parkinson's patients. Each of these prodrugs highlights the clever use of metabolism to optimize drug delivery and action. Importance of a prodrugs. So, what makes prodrugs indispensable in drug design? Improve solubility and absorption. Example, chloramphenicol palmitate improves oral administration by masking its bitterness. Prolong action. Example, testosterone propionate ensures a slow and steady release of testosterone. Targeted delivery. Example, capecitabine is converted into the cancer drug 5-fluorouracil, specifically in the tumor cells, sparing healthy tissues. Reduce toxicity. Example, acyclovir valyl ester reduces systemic side effects while improving drug tolerability. Prodrugs are a masterstroke in tailoring drugs for better patient outcomes. Applications in modern medicine. Both analogues and prodrugs have transformed modern medicine, overcoming drug resistance. Example, modifying tetracycline into dimethylcycline helps treat resistant bacterial strains. Enhancing patient compliance. Example, chloramphenicol. Palmitate makes antibiotics easier for children to take. Prolonging drug action. Example, prodrugs like testosterone propionate ensure steady and prolonged effects. Targeted therapy. Example, capecitabine activates in cancer cells, minimizing harm to healthy tissues. Thus, applications show the power of combining chemistry with biology in drug design. Conclusion. In summary, analogues and prodrugs are essential tools in drug design. Analogues improve the activity, stability, and safety of drugs by modifying their structure. Prodrugs solve challenges like poor solubility and enable targeted delivery by activating in the body. Both approaches demonstrate how science continues to innovate for better, more effective medications. Thank you for joining me on this exploration of analogues and prodrugs. If you're enjoying this content and want to see more, please consider subscribing to my channel.